Everybody, welcome to the Coronavirus Task Force meeting for Monday, May 18th, 2020. We've been holding these meetings twice weekly since the beginning of this outbreak. I'd like to announce that we're going to discontinue our Thursday meetings and just stick to Monday meetings, if that's okay with everybody on here. Seems like our Thursday meetings were becoming sort of a repeat of what we talked about on Monday. So we think it's a lot easier if we go ahead and just do it once weekly. And if anything happens, we start to have a jump in numbers, anything of that nature, we can go back to twice a week like we do now. But we're here today. The stock market is sky high today. People are going back to work across the United States of America. People are going to work in Indiana. We just entered a new stage in Lake County. We'll talk about when I do my report a little later. Seems like everything's real positive. The police department was going around this weekend and kids were in the playgrounds, not supposed to be, but they were there. People were sort of enjoying themselves. But I would like to point out to everybody that even though all these great things are happening and everybody's feeling real good about what's going on, we have 1,600 Hoosiers that have died from this disease since the beginning of this outbreak. We have almost 28,000 Hoosiers sick with this disease right now, and they're in our community. In fact, in the city of Hammond alone, we have 343. This is I'm sorry, where are my numbers? On the front page. 15, unfortunately, fatalities in the city of Hammond. That's picked up since the last time we spoke. We had a week ago, we had 13 deaths in the city of Hammond. We have 2 more. A week ago, when we last spoke, we had 401 positive cases in the city of Hammond, and that's gone up. We have 75 new cases since then, so we're at 476 positive cases in Hammond, Indiana. These are disturbing numbers. That's just in our city. So even though the stock market's sky high, people are going back to work, people are going to restaurants, doesn't mean that we could let our guard down. We still have to socially distance. We still have to wear our mask in public. We still can't shake hands or hug or kiss, any of those things that we used to do. So without further ado, like we do every meeting, I'm going to go to Dr. Frank Masada from Comprehensive Care, and he'll be followed by Karen Callahan at Franciscan Healthcare Center, Hammond. I'd like to remind everybody that we have Brittany translating for us, for those that are hearing impaired. And we appreciate her doing that. And I'm asking the people that speak to please speak slowly so that she can keep up with us. So, Dr. Frank, how you doing?
Good morning. I think from the medical standpoint, the one thing that may be contributing to the stock market going so sky high was news this morning from Moderna that they had successful phase 1 trials on their vaccination. So they had 45 individuals, I believe it was 45, and they gave them 2 doses of the vaccine, and their antibody response was basically the same as when compared to people who have recovered from the illness, who've gotten the illness and recovered when they measured it against the blood. So it's a very positive response, meaning that it's very likely that there will be a vaccine sometime this year. If they're able to get it produced in quantity, and all those things remain to be seen. But they're moving right into phase 2, and I imagine that will go quickly, and they'll go into phase 3. So that's a positive, and I think that's a big reason why the market.
You said it's Moderna. That's the name of the company.
Moderna.
Moderna. It's
an
American.
Moderna, yeah.
It's an American company, right?
American company, yeah.
So that's good news but the logistically though, just because let's say that they do have a vaccine and it ends up being the vaccine we need, they still need to make hundreds of millions of doses and get it out to all Americans, right?
Yes. So what I'm personally hoping for is that there's going to be multiple vaccines that are successfully, made, which means that there's multiple companies producing them, because there won't be enough. And it's not just this country, but the world is going to want this vaccine. So you're absolutely right. That is, that's a big part of this whole thing. And I know that there are I know there was the task force. They put a general, and I don't remember all the details, who's in charge of procurement for the United States Army, in charge of the procurement process for all of the supplies necessary to provide the vaccine. Not necessarily the vaccine itself, but the syringes, the needles, all of the other things, so that they can get the vaccine out as quickly as possible when it is ready to be distributed. So they've got time to do that. I don't anticipate this will happen, until, at the earliest sometime in the fall, but probably not until late fall. But it's positive. It's actually very positive.
But doctor, so if we have a vaccine though, even if, okay, so getting hundreds of millions of doses out to all Americans, that's logistically humongous problem. I mean, because you have glass, you have to have the little glass tubes for the vaccine and stuff like that, right?
Yeah.
Which is monumental task to come up with hundreds of millions of individual doses.
No doubt about it.
So I'm asking, so if we know for a fact that this is the vaccine, can we go back to shaking hands and hugging and going back to church, knowing that if I get sick and I go to the hospital, at least there's a vaccine that could save my life? Is that why the stock market's jumping? I mean,
I think that, so to answer your question, the vaccine will not help you once you've become infected. The vaccine is something you need to have before you come into contact with the virus. It stimulates the body to create the antibodies that will fight the virus. So I think that if this is the reason the stock market's going up, and I'm not
it's not going to help prevent you. It's not going to help you if you're already sick.
No, it's not. It's not. But it is an optimistic sign, because that means that there is something coming. So to go back to doing everything we were doing just because the vaccine's there is not the right thing to do. Once people have been vaccinated and there is immunity, well, then that's a different story altogether. And I suspect we're going to have some permanent changes as a result of this that you may see. You may see the plastic shields stay up at the supermarkets. You may see some of the other things, linger on. But yeah, once the vaccine is distributed, you'll be protected.
So basically, it'll be like any other type of measles vaccine, smallpox, things of that nature. We'll just get the shot, and then theoretically, you're immune to the coronavirus. Correct. That's great.
It is. It is.
But even assuming that this is the vaccine, that you're saying, I mean, realistically, it's not going to be widely available before the end of the year or towards the end of the year?
I don't know for sure. I would anticipate that it's going to take about that long, but things have been moving at, such fast pace. We could be surprised. They may be able to accelerate it and have it here sooner, but my guess would be late fall, because they still have to go through the phase 2 and the phase 3. I doubt they'll be able to bypass that. Part of phase 3 is to do long-term studies of how the antibody affects somebody. Is somebody going to turn up ill, 6 months down the road? So, the typical process of getting a vaccine to market has a lot of time built into it to monitor effects of the vaccine, a period of time after someone's received it. We're not going to be able to do some of those things. So this vaccine will get out there quicker, but we won't have probably finished it the same way we normally would.
Well, today's May 18th, and the good thing about May 18th is Lake County Foolies enter stage 2 today, which is great for Dr. Frank because barbershops open and things like that. So,
yes, you've noticed. I'm looking forward to that day.
You're going out of business with just gel costs alone, probably. So.
Oh, there's no doubt about it. I haven't had hair this long in 30 years.
So, you got anything else you want to report on, Doctor?
No, I don't. I think that covers it for today.
Okay, we might come back to you in a couple of seconds. So, I'll go to Karen Callahan from Franciscan Healthcare Center. Hammond, how you doing, Karen? Hold on. We'll get you taken care of here.
There we go. Hi. Good. Can you hear me this week?
You look great.
Oh yeah, I need to go. I got a beauty appointment this week, so I'm super happy.
They're open at 50% capacity today, so.
Thank God. Okay, so the hospital, we have 26 positives, 9 rule-outs. From March 15th until now, we've had 249 patients discharged home from the ED and inpatient with positive COVID, 39 deceased. So that would put our mortality rate about 6%, right? If I'm doing the math correct, which most flus, and Dr. Masada can probably attest, are about 1 to 2%. So that is a higher mortality rate. And that's just basic math, just done here. And the reason, and right now we have 95 patients admitted. Our ICU is full, but we have plenty of vents. That means that we still have the curve is flattened. It's full just from sick people, not necessarily all of them COVID patients.
That's the first time in a while you've reported a full ICU, right?
Yeah, I think in between the days of Mondays and Thursdays, we've had times where they have 2 patients up for transfer, which means that they're full, but they have 2, like what we call a step down patient that are able to go out, but the other units are kind of full too. And some of it is related to nurse capacity in the East Wings, where we don't have as many nurses as we'd like to. We are seeing some nurse burnout. So those little commercials that you see that we're here for you, so please stay home for us. I would say from a hospital perspective, I would still appreciate people, going out necessarily when, of course, also maintaining all those last 8 weeks, hand washing. I sent Phil a video, maybe he can put it on Go Hammond, and it shows a black light experiment where they had gel on someone's hands and they showed in a restaurant how many spots that the virus was, a virus, I mean, not the coronavirus, but it was an experiment. So he's gonna try to put that on, or maybe for next Monday. So I want people to remember all of this, and we'll see in the next week if we get an increase in cases.
Okay. You agree that once a week is fine for the coronavirus task force? You still be able to participate on Mondays?
I do. I think once a week is great. We'll, give out the information that we can. I do want to just be the counterpoint to Dr. Masada in regards to the vaccine. I worry a little bit about, I'm not sure which one it was, if it was smallpox or mumps, but they did the vaccine early and a lot of people actually got the illness. And I don't know if Dr. Masada remembers either, but I would say we need to make sure that all those correct trials are done. And I don't want people to have a false reassurance that, oh, no problem, we're going to have a vaccine. We just have to make sure that it's the right one from the FDA. So okay. That's just my take on it. I don't think any of these measures that we've put in place, handshaking you were talking about, in my opinion, it's going to be a long time before that completely comes back, unfortunately.
What about baseball games, things like that? It's going to be a while, concerts.
Well, I think personally that if we do it correctly, you can even social distance bleachers, if you think about it. I think the best thing that's come out of this is the creativity that people have done to get their businesses open. We've really transformed the world into making it social distance. So I think moving forward, because we need those things, you're right, people are so happy when they're out and about, but they just have to do it smart. And I think we can move forward.
I know the White Sox will have no problem with social distancing in their stadium. So,
hey, I'm a Sox fan. I'm a South Sider.
Thank you. Don't forget to tip your bartender.
Good one. And that's. Oh, I do have a quick question for the city of Hammond. The Gosselin, is that gone? The emissions test is there on gohammond.com the open testing?
Good question. Could somebody look that up? Are they still, Awana, are you on there? Could somebody help with that question? Are they still doing the testing for coronavirus at the Gosselin location? I will look that up and we'll give that answer back. So I appreciate that.
And I just want to say the reason why real quick is because of people come to the ER for I need a test to go back to work, they don't really meet our criteria to test. So I wanted to offer them places that they could go, and someone told me that the admissions might be closed. So someone can text me or let me know. Thanks.
We will do, during this video, we will come up with a list of all locations. It's closed. The one I just found out, the one on Gosselin at the admissions plant, the admissions facility is closed. So
Okay.
but we will come up with a list of locations close by Hammond where we could get coronavirus tests currently, okay? I appreciate it.
Great, thank you.
Thanks, Karen. I'd like to point out, we'll do a couple we are at May 18th, and I've had a couple questions on the internet. One of the questions was, is City Hall open? City Hall opened last week. It's open by appointment only, but I'll be honest with you. At this point, I think mostly people are just coming in and doing business. We're maintaining social distancing. People in City Hall are wearing masks. It's advised if you're 65 or older, you stay at home. We are checking temperatures to get in City Hall. So that's currently what's going on in City Hall to answer that question. Gathering limits are up to 25 people right now. We're in stage 2. Religious services are allowed. We've had a couple churches that are actually having services. Catholic churches still aren't, and I know a lot of missionary Baptist churches still aren't. But First Baptist Church in Hammond are having services. They started last week. They're maintaining social distancing, 65 and older, stay at home, things of that nature. Retailers that were curbside only are now operating at 50% capacity. That's like liquor stores, clothing stores, jewelry stores, furniture stores, things of that nature. May 18th, which is today, restaurants, barber shops, beauty salons, tattoo parlors, etc. open up today at 50% capacity. No bar seating is allowed in any restaurants. So you could go have breakfast at the Wheel today. You could go have lunch at John L's. Restaurants are open at 50% capacity. I know each restaurant is doing their best for maintaining a healthy environment. And what is still closed? Bars and nightclubs are still closed. Gyms and community centers are still closed. Playgrounds, tennis courts, basketball courts, still closed. Sports venues, like the Sportsplex, still closed. Casinos, still closed. Movie theaters, still closed. Pools, schools, and universities, still closed. Next Monday, when we have our next coronavirus task force meeting, we will be heading into stage 3, assuming our numbers are going according to plan, at which point retail stores and malls can increase their capacity limits. Gyms and fitness centers may open with restrictions. And I believe the Hammond YMCA plans to open next Monday. Planet Fitness, things of that nature can open next Monday with limitations. Playgrounds, tennis courts, basketball courts, etc. open next Monday with social distancing. Movie theaters open next Monday, 50% capacity. So as of next week, the only thing that remains closed are schools, bars, nightclubs, and sports venues. That's stage 3. Any questions from anybody about that? Dr. Frank? Are you good with the meeting on Monday still? I forgot to ask you that.
Yes, that'll work for me.
Memorial Day, what? That's next Monday. Next Monday is Memorial Day. Good point. You guys, could we do next Tuesday for the coronavirus task force meeting since Monday's Memorial Day? Karen, are you good with that? Frank, you good? Everybody else good with that? So we'll do next week's meeting on Tuesday, 10:30, coronavirus task force, because Monday's Memorial Day, and we'll give the Monday update on Tuesday instead. We're gonna have a Hammond Police Department represented by the Assistant Chief of Police, Andy Short. Andy, could you go ahead and do an update for the crowd?
Good morning, everybody. Our PPE, we're pretty stable for the next month or 2 months. In regards to our officer that is still off sick, he tested negative, but he still has symptoms. And we still getting a lot of calls about the parks areas and stuff. I like to stress, hey, we still up under the governor's order, but lately we've been running quite a bit here. I was out there Friday and Saturday, and the more I turn on my sirens, it seems like when I turn the corner, people coming right back out. And I know Saturday I was out there for about 4 to 5 hours, and our guys are running. Our guys are running. So if we get a lot of calls about people who's out in the parks, especially between the hours of 1 and 4, I have to say our guys are just totally busy, because I know I answered a call with a large fight on Elizabeth Street, a mental subject that wanted to kill herself on, I'm not gonna name that street, but she was put her head through the window. We're pretty busy out there. We become more of the essential police instead of Hammond Police.
Okay, thank you very much, Chief. Appreciate it. We'll go ahead to the Hammond Fire Department. The Deputy Chief, Kevin Margraf. How you doing, Kev?
Good morning, Mayor. Morning, everybody. Fire department's doing well. PPE's in good shape. We're still, just in case there may be an uptick of this somewhere in the fall, where some reports have said it may be, some others aren't. We still have PPE that's on order. We're going to still stay vigilant in trying to make sure that we have plenty going forward, just in case, or maybe for something that happens beyond. We've got nobody that's off currently in regards to COVID-19. We've probably had 15 individuals tested, 13 negatives, 2 positives. Everybody's back to work. Call volume is roughly still the same. A lot of the minor stuff that the chief talked about with you on Friday, that those type of calls are down. Difficulty breathing, sick person, those type calls have ticked up. But all in all, I mean, our call volume is down. Certainly fires are down, and fire department's holding our own.
Okay, thank you very much.
Thank you.
I got a list of locations where you could get tested for COVID-19. I'll go through them. Midwest Express Clinic in Munster, Community Hospital in Munster, Midwest Express Clinic in Cherryville, Midwest Express Clinic in Crown Point, Franciscan Alliance Hospital in Hammond, Methodist Hospital in Maryville. Those are the locations we have right now where you could get checked for COVID-19. Anybody else have anything? Johnny, come over here. This is Johnny Perez of the Hammond Department of Public Works. How you doing, Johnny?
Good morning, Mayor. Good morning, everybody. We have plenty PPE. Office is open for business as usual, handling accessible signs, garbage cans. Also, we have an employee that we sent home today because his daughter tested positive.
Right.
So we're trying to be cautious on that.
Gotcha.
And
how many people have been positive in Public Works?
well, Mayor, it was one. It was on quarantine, and now this one is going to be in quarantine. So far, only one positive, man.
One positive, and that person's already back to work?
Back to work. And that's happened at the beginning when all of this happened.
Okay. We still are on time with garbage collection?
On time.
And then recycling still being picked up by Republic on time?
Republic, yes. And if there's an issue, they call the office and we call, Republic, Otherwise, it's open as usual.
Okay. Thank you very much, Johnny. Appreciate it. Does anybody else have anything they want to report?
Juana's got her hand raised.
Oh, Awana's got her hand raised. Hold on. We'll go to Awana. How you doing, Awana? Can you have your video turn on? Awana, can you hear me?
Hello.
Oh, hey.
Hey, how are you? I've been working with the school city as well as the Indiana State Department of Health. They're looking at Morton High School parking lot to have a testing site. They were looking at May 21st through May 24th of this week. I haven't got a solid confirmation back yet. I'm hoping to get that today. It's basically open for anybody, especially first responders, essential workers, and asymptomatic individuals. National Guard is supposed to be out there to direct traffic, and that's the report that I have so far.
Okay, thank you very much, Alana.
No problem.
Okay, I'm going through questions real quick. There's a question for Karen Callahan, actually. Franciscan, Karen, could you unmute?
Yeah.
There was a question that said, when will the restrictions for one person going into the hospitals ease? I don't know if you know the answer to that, where.
So I can answer that at this point right now. Our incident command that it meets daily in the hospital has not lifted that restriction. I do want to say to the public, we appreciate their patience through this because it is difficult for them not to be with their loved ones. So I don't have an answer for that right now, but it is reviewed daily.
Thank you, I appreciate it.
You're welcome.
And going through real quick, Barry says, open the city. Barry, the city's open. It's been open. I mean, we went along with Governor Holcomb's order every step of the way. We never restricted it at all. So I'm not sure where that comment came from. The city's right on track with the state of Indiana. So if you're frustrated with the state, Governor Holcomb is the guy you focus your attention on. Just don't cancel Hammond Day. Festivals, I haven't heard of a festival that's going down as normal this year, including the Festival of the Lakes. Festival of the Lakes isn't happening as we've become accustomed to. It's fact. You know, the only thing we're talking about at this point is what to do with the acts that we secured way before the pandemic even started in China. So we have outstanding obligations with a couple of our artists that we're trying to work through right now, but there's no Festival of the Lakes this year. That's not going to be the carnival, the rides, all the stuff you've become accustomed to, not in 2020. So sorry to Dominique if I broke your heart on that, but I haven't heard of too many fests that are going as scheduled. Go Cubs, go White Sox, go Cubs. We've got a few of those. I guess that's my fault. When do you anticipate universities opening? Anybody on here? I wish I had Chancellor Keon. I don't think summer school is happening. I talked to Chancellor Keon just the other day. He informed me that at Purdue Northwest, they're really worried about the fall semester and the low number of students that are applying for college right now, obviously because of what's going on with the economy. I don't anticipate universities opening before August personally, but I'm not in charge of them. I know schools are shut down the rest of the years in the school city Hammond. Let's see. Okay. Are they canceling Beetles Fest? That's a private event, not run by the city. I imagine it's canceled, but I'm not the one that's going to be able to make that announcement. That's going to come from the organizers of Beetles Fest. I imagine you'll be hearing from that soon. Does anybody else have any questions they want to bring up before we terminate this week's meeting? Yeah, Dr. Frank.
Yeah, real quick. So just two things. One, there's something I've been watching that I haven't really talked about, and it's called the RT rate. And it's just a measure of the spread of the virus. So how many people does one person infect? And 1 or below is where you want to see it. And that's consistent with what we see with flu. 6 weeks ago, there were 31 states that were above 1. Today, there's 1 state that's above 1, and it's 1.01. So that's a positive thing. It's showing that the infectiousness of it is declining. And I'm not saying that this virus is any less infectious. What I think is more, this is more towards is all of the things we've done to try to put the measures in place to minimize the transmission by wearing masks, socially distancing. We've had the stay in shelter, which is now opening. It's Memorial Day weekend. I just want to remind everybody, be smart, enjoy yourselves. Hopefully the weather will be nice, but don't go crazy and forget about all the things we've been doing. It's been working, so let's just try to stick with it. I'm all for getting back responsibly and safely. As long as we do that, I think we can see these numbers staying where they're at. So
you're saying the R value is how many people, if I have coronavirus, how many people I infect myself, right? So if
Correct.
it's one, that means I infect one other person on average, right?
Correct.
Okay, so obviously because we all went to our houses and socially distanced and sheltered in place, that lowered the R value down to where it is now.
Correct.
So would you expect that to go back up as we start loosening things up?
You know, I think it'll fluctuate. Most states, I think 35 of them are below 9.9. So there's room to go. So I would expect that number to move as long as it doesn't get significantly above 1. It means we're actually in pretty good shape.
What was it before we sheltered in place? Do you know?
This thing only goes back 6 weeks, and you didn't have anything more. The highest was 1.18. So none of them were dramatically high, you know, where we were fearing it might go to, you know, 5 to 6 people. But if you watch the trend, it's just each state has slowly gone down. So it'll change. But I think just being smart will help mitigate that from going, you know, real high. As we get out and things start opening up, you're going to have more interactions with people. So we know there's going to be more cases, but you can minimize that by just doing the smart things that we all know to do, wearing your mask, or if you can't socially distance, wash your hands, and just be responsible, and we should be successful.
Okay. Question about School City Hammond. Will the School City Hammond open up in August? That's obviously an issue that's going to be answered by Superintendent Miller. And I don't believe the school city is represented on this phone call, unfortunately, today. I imagine they're going to definitely make all efforts they can to open up in August. And I would also sort of mentally prepare for a hybrid of in-class and e-learning more extensively than we've become accustomed to. And, you know, I've heard of some states even talking about starting kids in the summer, anticipating a possible second wave and an interruption in the next school year. So, but that's something that has to be anticipated and discussed by our school city. Casinos, I like the way Debbie's thinking. When is the casino going to open? June 14th was the earliest, I believe, the casinos were allowed to open. That's something that they're working. The casino industry is working specifically with our governor on that issue as we speak. Question, Karen or Dr. Frank, can a person still infect somebody if they are wearing a mask?
So I'll take that one. So remember that chart that we kind of went through a few weeks ago? I'm just going to go through it. If a COVID-19 carrier is not wearing a mask and somebody else is wearing a mask, the probability of that person catching it is still 70%. If the COVID-19 carrier is wearing a mask, their probability goes down to 5% if you're not wearing a mask. And so if you're both wearing masks, it's 1.5%. So what that really tells you is that wearing masks is most effective when the infected person is wearing a mask. And since we know there is a large amount of asymptomatic cases out there, we still recommend that everybody wears a mask because you just don't know who does and doesn't have it.
And the only other thing I would add is don't forget that the coronavirus is basically like the steroid, right? It's instead of a 1-to-1 infection, it's like a 1-to-6 infection. It's very strong, it's very virulent, and it can affect more people. So masks, hand washing is truly, truly the key.
Thank you, guys. Appreciate it. I think we've got one complaint for the police department since I'm sitting next to the assistant chief. Mayor, please ask for more patrolling on Jackson Street off 165th, northbound slot. There's speeding, northbound lane. So there you go.
Okay.
Jackson Street, right off 165th. All right, last question. Are the blue disposable masks effective against COVID-19? I hope so, because I've been wearing them. Karen or Dr. Frank, the blue masks?
The surgical masks, yes.
They're
Yes.
effective. They're not as effective as N95, but they're effective, right?
Correct.
Okay. Okay. Are we good? All right. I want to thank everybody for their participation. I want to thank Brittany for translating very much. I want to remind everybody, instead of a Monday meeting next week, we're doing it a day later. So we won't meet again as a task force for 8 days, 10:30 on Tuesday after Memorial Day. Thank you, everybody. Stay safe. Wash your hands.
Thank you.